All right, good morning, everyone. We're going to go ahead and get started. I'm going to read our statement. Good morning and welcome to DNA of a CEO, Lessons for Leading Home Health Care into the Future, presented jointly by the Alliance for Home Health Quality and Innovation and the Visiting Nurse Associations of America. This session is being recorded. This continuing nursing education activity has been approved for one contact hour by the Maryland Nurses Association, an accredited approver by the American Nurses Credentialing Center's Commission on Accreditation. In order to receive your certificate of completion, you will need to attend this program in its entirety and complete the evaluation available in the conference app. Certificates of completion are available at the registration desk. Our faculty has disclosed no conflict of interest. A copy of the full disclosure sheet is available on the table outside the room. I'd now like to introduce today's presenter. Stephen Tweed is an internationally known healthcare and business strategist, award-winning professional speaker, published author, and consultant. He works with CEOs and executive teams of home care companies that want to grow their businesses and to get ready for the future. Stephen?
Thank you. What a treat to be back a year ago today on this day of the conference. I don't know if it was exactly a year ago, but we met at the CEO breakfast at just before this time to introduce the CEOs of VNAs across the country to this research study that we were beginning. But our journey really goes back further than that. It goes back to December of 1997 in Portland, Maine, looking out over the snowy harbor at Portland. I was in the office of Chip Liversidge. I'm looking around the room. There's only a few of you who are even old enough to remember Chip. But I first met Chip when he ran the VNA in Louisville, Kentucky. And he invited me to be on his board of directors. And the first board meeting I attended, he announced his resignation to move from Louisville to Portland. I don't know if that was an omen or not. But Chip and I stayed connected, and he brought me back up to do some work with his board at Community Health Services in Portland. And after the board session, we were sitting in his office looking out over the snowy harbor, and Chip mentioned that he was beginning to get ready for retirement. He'd been doing this for 30 years, and he just decided that time had come. And I said, well, what are you going to do after you retire? You're not old enough to quit. I know you have enough energy, you're going to do something. He said, well, maybe I'd like to write a book. I said, well, that's interesting. What would you write about? He said, well, probably I would write about leadership. And I said, well, tell me more about that. Why would you want to write a book about leadership? And he said, I've been doing this a long time. I've grown up with home health and the Medicare program. And he said, if there's one regret that I have, it's that as an industry, we have not invested enough in developing the next generation of home health care leaders. And so it was that phrase, just spontaneously, that led us to this concept of developing the next generation of home health care leaders. And so Chip retired, moved back to Louisville, and he and I got together and put together an initial survey. And we reached out to about 200 VNA CEOs that we knew around the country. We did a paper and pencil survey, and from that research identified what we then called the top 10 competencies of highly effective home care leaders. And we developed some educational programs, and for the next decade, we did some educational programs around the country helping to develop leaders in home health care. Flash forward another 10 years to January of 2016, and my wife and I were talking about this whole notion of developing leaders in home health care. And Elizabeth is a nurse by education. She is an executive coach, and she uses these assessment tools in all of her executive team development and executive coaching. And I said, what if we were to repeat that study, to go out and get a couple hundred CEOs to complete this assessment? It would be a much more scientific approach to understanding the leadership competencies of highly effective CEOs. And so that led us to this research that's been going on for the past year. And so I come to you and say, okay, I'm sure you're coming saying, what's in it for me? Why is this research important? Why do I want to know what you're going to talk about today? And I think there are really three things that I'd like to stimulate your thinking about. The first one is to look in the mirror as a leader and say, what's my leadership style? And how does that style impact my organization and the culture of my organization? The second thing is to look at this information and say, how can I use these principles to develop my C-suite team, those key leaders who report to you in the C-suite, and again, to develop your bench strength. I was talking to a couple of folks who said, well, you know, when I got promoted to my current role, I looked back and there was nobody there to move in behind me because we just don't have a lot of bench strength. And then the third piece is really to get ready for the future. We've heard a lot in this conference about where healthcare is going, about the integration, about the use of data, but how do we then develop a team that's going to be able to do all of those things to deal with the challenges that we have going forward? So hopefully this research will help you do those three things. The assessment we use is called the TriMetrics DNA, and it's provided by a company in Scottsdale, Arizona called TTI Success Insights, and it measures three things. It measures behavior, it measures motivators, and it measures core leadership competencies. How many of you have taken the assessment and gotten your report back? How many have participated? A handful of you have. If you have not, I'll show you how to do that before we get to the end of the presentation. Our goal was to get 100 CEOs of not-for-profit home health agencies, 100 CEOs of for-profit home health agencies, and 100 CEOs of private duty home care companies. We didn't quite get there, but we came close. But we really wanted to thank all of our association co-sponsors, the VNAA, of course, the Home Care Association of America, which represents private duty agencies, the New England Home Care Conference in the 6 states in New England that sponsor that conference, and then a total of 14 state associations participated and supported the research. And so Elizabeth and I went and traveled to their conferences, spoke at their meetings, and then invited people to participate in the survey. So we had 260 participants, 131 were home health leaders, and 129 private duty leaders, and the home health sector broke out like this. Now, it was interesting, when we gathered the data, as often happens in research, what you think you're going to get is often different than what you actually get. And because we were speaking at these associations, we had a lot of CEOs participate, and 38%, almost 39% were from VNAs or not-for-profit home health agencies. And then we had a group of folks that I have, for a broad definition, called home health administrators. These are folks that lead a home health agency but are part of a bigger role and tend to function more as a director or a manager than really the CEO of an independent agency with its own board of directors. And then there were a number of CNOs, chief nursing officers, in the audience who went ahead and took the assessment, and so we identified them and we broke them out into a separate group. So that's going to lead to some more research. So if you are a chief nursing officer or have a chief nursing officer that you would like to have experienced this, we're going to give you an opportunity to let us know that, and we'll reach out and have those CNOs take the assessment as well, so we'll get a little bigger sample here. We had 129, I think, or 131 private duty CEOs, so we have a whole separate set of data on private duty. How many of you have a private pay business within your home health agency? How many of you are having a struggle getting it to grow or to make money? Okay, so we'll have a whole bunch of information available for you, and I'll show you how to get that report as well. On the table, you have this infographic that we put together that gives you a snapshot of the data. And on the bottom of that sheet, and I'll also put it up on the screen, is a website where you can go to download the full 20-page research report. The website is dnaofaceo.com. Now, we were able to ask some demographic questions at the front of this assessment, and so of the agencies who responded, 55% of them were over $10 million, and we found out that 83% or 85% of the agencies over 10 million, I'm sorry, I got it backwards, 85% of the VNAs who participated were over 10 million, and 67% of the total agencies over 10 million were VNAs. And so we had a really good sample of larger agencies. And of course, we know that there are some very, very large agencies, but if you look at the demographics of home health across the spectrum, there are a lot of relatively small companies out there. We also looked at growth rate, and this graph represents the growth rate by percentages, and you can see there's a whole bunch of companies that didn't grow very much in 2016, or 2015 actually, because this was using year-end data from last year. But we did have a good sample of companies that grew over 20%. And so we're able to separate out some of that data and look at the competencies of CEOs of these larger, faster-growing companies. And then we also looked at profitability, and again, we saw some interesting data here in terms of the large number of agencies that have relatively low net margins. And so we, again, are able to look at these companies, smaller number of companies that have higher net income. Questions, comments about any of the early data so far? Yes? You know, that's a great question. We didn't ask that question. We simply gave them a choice of 5 categories and asked them about growth. One of the things I've learned about research is the more questions we ask, the more questions we wish we had asked, because it raises those kinds of questions. So don't know the answer to it, but it's a good question for the next time we do some more research. So we look at this assessment tool and the big picture of it, and as I said, it measures 3 things: behavior, motivators, or what we call driving forces, and core competencies. So behavior is sort of how people will interact. Driving forces or core competencies or motivators, driving forces or motivators are the why, and then the competencies are the what. And so we're going to look at each part of that separately. The first part is behavior. And how many have experienced the DISC assessment tool at some point in your career? Okay, many of you have had. This model of doing behavioral assessment has been around for 70 years. It's fairly common. There are many different companies that use this or a version of it to assess behavior. And so the TriMetrics has behavior as the first element. And those of you who are not familiar with it, the big picture here is that the D represents dominant factor, and that's how you respond to problems and challenges. I is the influencing factor, and that's how you influence others to your point of view. S is steadiness. That's how you respond to the pace of the environment. And this is interesting because the higher the S, the lower the sense of urgency. The lower the S, the higher the sense of urgency. And then C is compliance, how you respond to rules and procedures set by others. And all of us demonstrate all 4 of these behavioral styles, but we tend to have 1 or 2 that are primary. Most of us will have one of them, what we call above the midline, and many of us will have 2 of those points above the midline. So this is a fairly common graph, 2 points above the midline, 2 points below the midline. This particular model uses 2 different graphs. The graph on the left, called the natural graph, is how you are naturally, how you're hardwired. The graph on the left is your adapted style. That is how you adapt your behavior based on what you think the job requires. And so if we get a person like this, whose 2 graphs are very, very similar, that's sort of what you see is what you get. If, on the other hand, you have someone whose 2 graphs are quite different, what that suggests is that they are adapting their style based on what they think the job requires. Now, we all have the ability to do that, but it causes emotional distress when we have to spend a huge part of our time adapting our behavior, and so then we need to have mechanisms to rest. I'll give you a specific example, and I'll use me. My natural style is a D above the line, C above the line. My I, the outgoing extrovert, is relatively low. Now, because I'm a professional speaker, people think I'm naturally an extrovert, but I'm not. So I can adapt. I can be friendly, and I can be cheerful, and I can talk to people, and I can be up in front of a group. And this afternoon, when I get my fanny on that airplane seat, I'm going to pass out. I'm going to be totally exhausted because I've been with you all for 2 days, and quite frankly, you're wearing me out. But I love you just the same. It's just I have to adapt and adjust. And so as we look at the results, this graph is the most common graph that we saw among CEOs. And it's got this little thing here we call the Entrepreneurial Hook. What we're seeing is most of the CEOs in larger, higher performing companies demonstrated the high D, the dominant, take charge, make things happen. The high Ds are impatient. That's why we start with them. Otherwise, they get up and leave. The Is are the outgoing extroverts. And you can see in this graph, the I is slightly lower than the D. And the 2 of them in combination create this unique combination. The S is really low. And remember, we said the higher the S, the more stable, the steady, the slower to change. The lower the S, the higher the sense of urgency. And so what we have here are a group of CEOs with a relatively high sense of urgency. And then the hook coming back up is the C. That's the accurate perfectionist wanting the details. And we're seeing that popping back up. So what we learned from this group of CEOs is that as a group, they tend to be more dominant in solving problems and addressing challenges. They're more extroverted in influencing others. They tend to have a higher sense of urgency, and they get impatient. How many of you are CEOs and you're frustrated by the fact that you can think up ideas faster than your team can implement them? We all have that in common, right? And as I work with CEOs in home health and in private duty all across the United States and Canada, I see that common experience, that we can create ideas faster than people can implement them. And then the last one here is these CEOs tend to want accuracy in details. They just don't want to do it themselves. And so having people around who like to do the details, who like to do the quality assurance, who like to do the finances, and give them reports that are accurate and precise, but they don't have to dig in and do the details themselves. How many feels like that fits you? Anybody looking in the mirror here and saying, that looks like me? Okay, good. Now, what if I'm not that profile? Well, again, there's no one right profile. There is no right or wrong or good or bad. It's simply observing what behaviors people tend to exhibit. But again, we see it in other kinds of businesses that a lot of CEOs, a lot of entrepreneurs demonstrate this style. Now, I ask how many of you have a private pay business and it's struggling. And one of the things we've discovered is that most VNAs that have a private pay business struggle with that business. And the reason is, there are four of them, but the big reason is lack of entrepreneurial leadership. They've moved somebody into that position who's a really nice person. They're a middle manager in their agency. Maybe they're a clinician. And we say, we want you to go over and run this private pay business. And they may be a very good administrator, but they don't bring that entrepreneurial drive to grow the business and to make it profitable. And so if you would like to receive a copy of the private duty research, let me know, and we'll be sure and send you a copy of that report as well. Questions, comments about the behavior piece? Observations, smart remarks? Okay. So the other thing, as I mentioned, is that in the midst of this process, we discovered as we were going through the results that not everybody that participated in the survey would be what we might call a CEO of an independent company. Even if you're affiliated with, let's say, a big health system, if you have a certain amount of autonomy, maybe you have your own board of directors, then you would fit that category. But we had a lot of folks who were running a home health agency, but they were more of an administrator, a middle manager within their larger system, and their behavioral style was quite different as a group than the behavioral style of the CEOs. And then we had a number of chief nursing officers who were in attendance at our presentations, and they went online and completed the assessment, which was fine. We invited them to do that. And so fortunately, we were able to separate them out. And as we looked at that group, now this is a very small sample, and so our next step will be to get a bigger sample and see if the data hold true. But as you can see here, what we have is on the left, we have the CEOs who are D's and I's with the S way down and the C coming back up, this entrepreneurial hook. The administrators, and some of these were what we might call a chief operating officer, were folks who were people-oriented. The I and the S are both people-oriented styles, but they also brought this accuracy and compliant piece, but none of them are as high or as dominant as the D's and the I's over here. And then we go over here with the chief nursing officers, and again, we see the C coming up as the dominant style for many of them. Again, that's that accurate, compliant, detail-oriented, and also the S, which is the stable, steady. And as we have done this assessment with lots of nurses in different kinds of roles, that's a fairly common pattern for a nurse. And again, no right or wrong, but yes?
So in the CEO category, was there a proportion of those who were also nurses by training, or are they mutually exclusive?
Great question. Don't know the answer to that because we didn't ask the question. However, knowing many of the individuals who participated, I know that there are nurses in there who are running agencies, and some of them have a style that's more of the administrator role, but there are some of them who have that CEO entrepreneurial hook. And so being a nurse by education doesn't necessarily mean that's going to be your behavioral style. And so what we saw is folks who bring that entrepreneurial style, happen to go into nursing as a vocation, very quickly got promoted into managerial roles and rose through the ranks to become CEOs of their agencies because they bring that entrepreneurial behavioral style. Does that make sense? Other questions? Yes? Great question. Have not yet broken out the data, but my preliminary look is no. I would say that on the not-for-profit side, we had more agency CEOs who look more like that administrator profile, but equal number who were more the entrepreneurial hook style. And I'll have to go back and sort out the for-profits from the not-for-profits and see if I can get a better picture of that. Originally, that's what we wanted to do. We wanted to have 100 of each, but it didn't quite work out that way. But good question. Other questions, comments, thoughts? Okay. The next place is what we call workplace motivators. And while the DISC is wildly popular and many people have used the DISC, this is a much newer science, and this company has really dug deeply into using this science and combining it with the DISC. And so that's one of the things that separates this tool apart from many other assessments that are out there. And this looks at why we do what we do. It looks at our hidden motivators, and it measures the prominence of 6 basic interests or values or ways of valuing life, and then it ranks your relative passion. And so we look at the 12 driving forces based on these 6 motivators. The first one is the theoretical motivator, and that's the drive for knowledge or learning. And people who are very high in this driver want to learn purely for the sake of learning. They're curious, they read, they study, they go to workshops and seminars because they want information, and it may or may not be directly tied to their job or their vocation. The second driver is what we call utilitarian or utility, and that's the drive for outcomes, for money, for measurable results. The third one is aesthetic, and that's the drive for harmony in your surroundings, and part of that may be visual aesthetics, part of that may be harmony with other people, but it really is this drive for harmony. 4 is social, and this is the drive to help other people. And as you would imagine, many of the people in home care, even though they bring that entrepreneurial behavioral style, do this because they're motivated to help other people. So we see a fairly high social. 5 is individualistic, and this is the drive for power or control or freedom or autonomy. And then 6 is what we call traditional, and this is the drive for order and methods and systems and processes. And again, all of us have some of all 6 of these, but we will tend to have 2 of them that are primary drivers, 2 of them that are secondary drivers, and of the 12 possible choices, we're looking at 2 ends of the continuum, we look at the 4 top driving forces, 4 out of 12. And so when we look at the 2 ends of the continuum, the one end is intellectual, that is the drive just to learn for the sake of learning. The other end of the continuum is instinctive, and that is, yes, I want to learn, but the knowledge needs to be relevant to what I'm doing right now. So different approaches to learning. Utilitarian, selfless on one hand, the one end of the score is generously assist others with minimal expectations. The other end, the resourceful end, is somebody who's driven by practical results, efficiency, return on investment, talent, energy, all of those things that you might expect from somebody who's in more of an entrepreneurial role. In terms of selective of aesthetics, again, we have those who are driven by this desire for harmony in the experience, the subject, viewpoints. The other end of the continuum is objective, driven by functionality, objectivity, view everything in pieces, and they can compartmentalize these pieces and sometimes thrive on chaos. Social is the desire to help others, and we have altruistic, which is those who give generously, serving others with no expectation of anything in return, and then we have the intentional, and those are folks who assist others based on a personal interest or a specific purpose. This was an eye-opener for my wife. Elizabeth is a nurse by background. She's been a speaker and author and executive coach for many, many years. She works with CEOs in hospitals and health systems, and right now she's doing a group of physicians in a medical school. And so you would tend to think that being a nurse and being a professional speaker, that she would be high social. But in fact, every time she did this assessment, she came out with low social. And she said, no, I want to help other people. Well, then when they took the two dimensions, the two ends of the continuum, and this intentional piece came up, the little light bulb went on for her. Because she said, yeah, that's right. I want to help people, but I want to help people in a specific setting with a specific need where I can apply my skills. And so she's been on the board of a girls' school in Louisville called Maryhurst for 20 years. And it's a school that cares for the most disadvantaged young women in our state. And many of them have been abused physically, mentally, sexually. They've been addicted to drugs, just all the things that can happen to a young woman that are not good, we see there at Maryhurst. And that's been her passion. So she does care about other people, but it's not broad, general care for others regardless. It's very intentional. So understanding that was a real eye-opener. Individualistic is the drive for power or control. And so the one end is collaborative. That is somebody who's comfortable in a supporting role and performs without the need for recognition. The other end of the spectrum is what we call commanding. And this is the person who is motivated by status, by recognition, who wants to assert control, who wants to have freedom and autonomy. And so we have those two ends of the spectrum. And then we have tradition, methodologies. One end is receptive, that is open to new ideas, methods, and opportunities. The other end is structured, driven by a traditional approach. They follow proven methods. And whenever I see someone, when I'm doing these and interpreting these assessments, if I see somebody who scores very, very high traditional, I say, tell me about your personal background. What is it in your background that causes you to really be moved by following a tradition? And often I find it's folks who come from a nationality or ethnic background that has high tradition. Elizabeth happens to be Italian Catholic from the west side of Chicago, so growing up in that family, tradition is very important. Sometimes I find that it's folks who spent a career in the military, and they come away with that structured way of thinking, way of doing things, and it's very comfortable for them. And again, no right or wrong, good or bad, but it's more about understanding what moves people to action. And so as you get this report and are able to take a look at your own motivators, again, you can look and say, yes, that fits me, or maybe not, I have some questions about that. If you decide you want to use this with other members of your team, you can begin to understand what moves them to action and how that varies from team member to team member. So we print it out on a graph, and again, we have the 6 dimensions running horizontally, and we have the two ends of the continuum. And so what we discovered as we looked at this CEO group is that a vast majority of CEOs are, first of all, high in commanding. That's this individualistic, which is the motivation for being in control, having power, having autonomy, having freedom. Again, does that fit with an entrepreneur? The second is resourceful, which is low utilitarian. I'm sorry, it's high utilitarian. So here's the utilitarian bar. Remember, that's the drive for money, for goals, for ROI, for outcomes. And so we have high utilitarian, which is resourceful. So the two highs are commanding and resourceful. And then the lows are the low aesthetic. Remember, that's surroundings. And so the score down here is objective. And so folks want an objective, functional look at a situation as opposed to beauty and peace and harmony. And then the other is low traditional or methodologies, and that is, remember, high here is structured, low is receptive, it's open to new ideas, it's open to new ways of doing things. It's open to trying new and different things. Questions, comments, observations about what we talked about thus far? Okay. So then we move into the 7 competencies. And the folks who developed this identified 25 leadership competencies, or what you and I might refer to as soft skills. And they developed an assessment tool that enables an individual, by answering a series of questions, to rank those soft skills in the order in which they are internally developed as skills or competencies within the leader. And while all of us demonstrate all 25 of the competencies, some of those are more highly developed, and some of those are less highly developed. And so we looked at all of the 25 competencies. We gathered all of the data from all of the 260 people who participated in the assessment. We separated them out into home health and private duty, so the lists are a little bit different in terms of ranking, but many of the core competencies are the same in both lists. So on the top of the list, and this is quite interesting, is goal orientation. And I'm going to tell you a little bit about the top 7 or so of these. Number 2 is flexibility. Number 3 is customer focus. Number 4 is interpersonal skills. Number 5 is employee development and coaching. Number 6 is understanding others. Number 7 is conflict management. 8 is leadership, self-starting, and continuous learning. So based on 260 people, breaking them into 2 groups, home health and private duty, this is the ranking for the home health CEOs. So as we look at each one of those, we see that goal orientation is really about setting priorities and attaining goals on a regular basis, regardless of the obstacles or the circumstances. Now think about your C-suite team. How many of the people that you work closely with in your organization would say demonstrate this competency of goal orientation and work consistently to set stretch goals, to achieve those goals, and to have mechanisms for tracking results? We're having some conversation this morning at breakfast about the whole notion of data and analytics, because there have been a lot of presentations here at this conference about using big data, about integrating systems, about looking at what payers need and want, and a lot of it comes back to looking at the data and how we present the data and how we communicate the data. And we were talking about to what extent do our C-suite leaders and our middle managers bring those analytical skills to have the ability to, first of all, set goals, but then use information and data to achieve those goals, to help the decision-making process. I have a friend out in Green Bay, Wisconsin, by the name of Dan Burris, who is probably the world's leading technology forecaster. And I've known Dan for 30 years, and he taught me about what he calls the 4 levels of your data stream. Raw data are the bits and bytes of information that you store in your EMR, and the raw data by itself is practically useless. It's only when you do something with that raw data where you tabulate it and organize it into some format that we get information. And oftentimes the reports that you get from your data system have that information. But again, it's only when we analyze and synthesize the information that we get knowledge that is helpful in making key decisions to grow our business, to improve performance, to improve quality, to improve profitability. And then Dan says, when you take knowledge and you mix it with gray hair, you get wisdom. Now, I don't know if it's a blessing or not, but I'm way older than I look because my grandfather gave me good hair genes. So I have very little gray hair, but I should have a lot more than I do. So I don't know if I'm not able to mix wisdom or knowledge and gray hair to get wisdom. But anyway, Dan taught me about that process. When we get to goal setting, part of it is defining the outcomes that we want, but we talk about SMART goals: specific, measurable, achievable, relevant, and time-based. And so do we have leaders who have developed this competency of setting and achieving goals regardless of the obstacles or circumstances? Number 2 on our list is flexibility, readily modifying, responding, and adapting to change with minimal resistance. And it's interesting because there's a correlation between this competency particularly as it relates to adapting to change with minimal resistance, and the behavioral styles of the S and the C. Because the S style particularly has a tendency to be relatively slow to change. People who are dominant high S need lots of information, they need to process it, they need to think it through. It's not that they won't change, it's that they need more time to process that change. The people who demonstrate the high C capability want facts and information and data and explanations and policies and procedures in order to make those kinds of changes. And so again, remember we saw the CEO styles on one side of the ledger and the CNO styles on the other. And so now we're talking about flexibility. What's the message there? And again, sometimes these research outcomes raise more questions than they answer, but it's certainly something for us to think about as leaders. As we're being flexible and as we're anticipating change, what do we need to do to help those folks on our team whose behavioral style and motivators are different than ours, and they need more information, more time, more processing to be willing to make the changes that we need to make, to be flexible, to adapt to what's coming down the road in our industry. Customer focus, no big surprise here that many of our CEOs are very much focused on the customer, anticipating meeting and exceeding customer needs and wants. And of course, this is sort of the big picture generic customer focus, but it raises the point for us in home health care is which customer are we talking about? Are we talking about the patient? Are we talking about the physician? Are we talking about the health system? Are we talking about the payer? Or all of the above? And I think that's part of the challenge that we face as leaders is that we tend to have more of a customer focus and understand those various categories of customers and what they need and want and expect from us. And we get to come to conferences like this and see some of the presentations about what payers are saying they want and what health systems are saying they want. But how does that information get translated to the next level of management who doesn't necessarily have the benefit of coming, hearing the presentations, interacting with others, and being aware of the needs and expectations of our customers. So again, I think there's a huge opportunity for us here to look at developing this competency across the board among members of our management team. Interpersonal skills, effectively communicating, building rapport, and relating well with all kinds of folks. And again, I think that all of us would probably say that we have a high level of interpersonal skills. One of the delusions I find is that many people, particularly in management roles, think that they personally are really good at their interpersonal skills, but if you ask the people that report to them, the scorecard might not be the same. The good news is I do not have any self-delusion. I know that my interpersonal skills are wanting, and if I forget, my wife will remind me frequently about the need to develop my interpersonal skills. I've been working on it for 68 years, and I'm making a little progress, but I got a long way to go. But again, I think recognizing the importance of that. How many are facing what I'm calling the caregiver recruiting and retention crisis? You don't have enough nurses, therapists, home health aides, and are you facing turnover issues? Some, not so much. But what we follow the wisdom of Marcus Buckingham from Gallup, who says people don't quit companies, they quit managers. And if you look at the research and the data, most people who leave an organization leave because of the relationship or lack thereof that they have with their immediate supervisor. And to most people on the front lines, their immediate boss is the agency. And how they see their boss and how they interact with their boss creates their worldview as it relates to how they see the agency. And so again, developing the team and looking at interpersonal skills and what does that mean and how do we grow them. And part of it is just creating an awareness of how do we come across. As I mentioned, my wife Elizabeth is an executive coach, and all of her work is working with CEOs and C-suite leaders in hospitals and health systems, and now she's working with this group of physicians in an academic medical center. And part of her role is holding up the mirror and helping people see themselves as others see them. So she uses this bank of 3 assessments plus 2 others, but part of her role is getting them to talk about how they interact, particularly with their bosses, and then to reflect on what they're saying and what they're doing and how is that working, and are you getting the outcomes, and what if you tried it a little differently. And so this whole notion of holding up the mirror and helping people see themselves as others see them. Employee development and coaching, facilitating, supporting, contributing to the professional growth of others. Had to use a sports analogy in here. I live in Louisville, Kentucky right now, the mecca of college basketball. That happens to be John Calipari at the University of Kentucky. I like John a lot because he and I went to the same college in Pennsylvania. I did not know that because John's 10 years younger than me. But when he came to Kentucky, I got invited to a reception and got to meet him and found out he and I went to the same school. So I've studied and followed his role as a coach and read his book called Players First. And there's some metaphors and lessons there about coaching. But there are really other elements. As a matter of fact, Elizabeth has a new book coming out probably midsummer called The Executive Coach. And it's all about how leaders can use questioning and listening skills to draw out members of their team and help them develop their skills to the next level. And she's really getting a lot of insights and information for this book based on working with these physicians in this academic medical center. So she's working with the dean of the Department of Medicine within the School of Medicine and the 20 people that report to him who are the directors of various elements of the medical school. And she said you want to look at some interesting lessons around coaching and development as you look at these individual physicians. And she said they're not a team. They don't pretend to be a team. They're each individuals, but they happen to be a group that's working under a dean in this medical school. She said it's a very interesting dynamic. Understanding others and accepting the uniqueness and contribution of others. And again, this is one of the things that we really love about using tools like this, is because it gives a new perception of other members of the team. And so we've done things like get a C-suite team together and have everybody do the assessment, and particularly the behavioral assessment, because behavior is what you see on the outside. And so we'll take that disc graph and we'll do some education around what it means, and then we'll print out that one page with the disc graph and we'll put it up on the wall. We'll put every person's name on the bottom of the page and we'll organize them. So we'll put all the D's over here, all the I's over here, all the S's here, and all the C's here, and then bring the team up and talk about, okay, here's so-and-so who's, we often start with the CEO because they've got broad shoulders and they can take it, and we look at their particular graph and say, okay, what does this mean and what does it reflect, and do you agree with that? Is that what you see? And of course, most people say, yes, that's how I am, that's how I see me, and others say, yes, that's how you are, and that's how we see you. And so it helps with that commonality to put it in graphic form so everybody, and now we have this this director of quality assurance who's a big high C. And everybody looks and says, okay, that makes sense. Or the chief financial officer who's a high C, because we want accuracy and detail and perfection in our financial reports. But then when we're working together as a team and we've got a CEO who's a D and an I, and we've got a marketing person who's an I and maybe an S, and then we've got the clinical, the quality person and the financial person who are S's and C's, and then we look at how they interact with one another. And so the more that we can understand others, what's their natural behavioral style, what are their natural motivators, and if we go deep enough, we can begin to look at what are the competencies that they have developed. And we like to say that all of these are strengths, but any strength that's overused can become a weakness. And so what we may see as problem behavior may simply be somebody who's overusing their strength, and we need to hold up the mirror for them and say, look at yourself, look at what's happening, look at the impact you're having, let's get some feedback from others that may help you temper that strength a little bit so that you're not overusing it so that it becomes a weakness. Conflict management, addressing and resolving conflict constructively. Do you all have any conflict within your leadership team in your organization? People are saying, no, not me. Certainly, particularly if we have a high-performance team of leaders and they represent these different behavioral styles, you're going to have a certain amount of healthy conflict. And so as a leader, it's how do we channel that? How do we encourage open discussion and disagreement, but yet do it in a constructive way so that in the end of our conversation we agree on the decisions we were going to make, and everybody's going to support that decision regardless of whether we supported it initially when we were going into the discussion. And so as a leader, how we manage that conflict, and do we address it? How many of you in your role as a leader have had a time when you've had two members of your team who, this is maybe a little bit strong, but two people who just despised each other? They just couldn't get along. And yet they're both key people, they both bring skills, they're both valuable. So how do you as a leader deal with that conflict? Do you ignore it and hope it'll go away? Do you get the people together and be a coach and facilitator and help them work it through? What are the things that you do to deal with that conflict? What happens when you have a situation, I'm sure many of you have had this, where somebody 2 levels down comes around their boss and comes to you and says, I can't do this anymore. This person is totally unreasonable and I can't do this and you got to help me or I'm going to quit. So again, how do you deal with layers in the organization and the conflict that happens between people at different levels? And so as leaders, developing this competency of conflict management. So we could go on and obviously we could spend a half a day on each one of these topics developing educational resources to help managers grow and develop. And that's our purpose going forward, is to take these top 10 competencies and dig more deeply into them and look at how we can develop these competencies within middle management and upper management teams in home health agencies across the US and Canada. So, what's in it for me? Again, back to this slide again. It's about looking in the mirror, it's about developing your C-suite, it's about getting ready for the future. So as you look in the mirror, what do you see? Do you like what you see and say, yes, this information reflects on me, it's the real me, I want to be true to who I am, therefore I'm going to continue to grow and develop and build on my strengths. The other thing Marcus Buckingham said, in addition to his comment about people don't quit companies, they quit managers, he said most organizations make the mistake that when they want to improve performance, they find their problems and fix them. And he said that rarely works. He said the best way to grow your organization and improve performance is to build on your strengths and manage around your weaknesses. And so as we look at these 3 elements of this assessment, and as you look in the mirror, it's an opportunity to say, let me reinforce what I know about myself and what this shows me are my strengths. And then how do I continue to use my strengths? How do I build on those strengths? What are the areas where I'm not as strong, and how do I manage around that? I can do it through other people. I can build a team of people. And so, for example, we know from the research that the entrepreneurial hook, the entrepreneurial leaders want the facts and the details and the information, they just don't want to do it themselves. So if that's not my strength to be analytical, but on the other hand, I want the results of that analysis to be able to make good decisions, I need to have somebody on my team who brings that analytical skill set that can help get me the raw data, get me the conclusions, and then we can sit down and talk about, okay, if this is where we are, and this is where we want to go, what is it that we need to do as a team? And that goes back to that goal-setting competency of how do we set a goal, how do we develop an action plan to get there, and how do we use that information and data to monitor our progress. But if it's not my strength, I need to have somebody around me who can help me with that competency. The next one is developing your C-suite. And one of the real lessons that has come out of our work, not only with this tool, but in working with CEOs in our home care mastermind groups, is the importance of role clarity. And Elizabeth identified this in working with these physicians who are academic medical school folks, is that one of their big challenges is they don't have real clarity about what their role is. And so in working with the folks at TTI, we've developed what we call a role clarity worksheet. And it's a fairly simple sheet, and it starts with the name of the job, and then a 1-sentence statement of purpose of the job, and then 5 key accountabilities. And the science says if you can't define the job in 5 key accountabilities, you don't have role clarity. If the person in that job can't state in 5 statements, these are the 5 things that I'm most responsible for achieving, then they don't have role clarity. And if you look at a traditional job description, it's got 27 responsibilities, followed by that one that's always at the bottom, and it says, and other duties as assigned. And so you ask somebody to look at that job description and say, what are you primarily responsible for? They can't tell you. But if you have a 1-sentence description that says that this job exists to get this outcome, and these are the 5 key accountabilities, and then what are the metrics? How do we measure the performance of that job in quantifiable metrics? 7 numbers, 5 to 7 key metrics. And so if you can have purpose, key accountabilities, 5 to 7 metrics, now you've got role clarity. Then we begin to look at job fit in the context of the 3 elements of this assessment: behavior, motivators, and competencies. And so we create a benchmark for the job itself. And we say, okay, we have the job of chief financial officer, and here's the purpose, and here's the 5 accountabilities, and here's the metrics. Now let's do a benchmark so that we know what the behavioral style will be of the ideal candidate. We'll look at the workplace motivators for the ideal candidate, and we'll look at the top 7 or 10 core competencies from the ideal candidate. So we've defined the job. Now we can look at all the candidates and say, of all the candidates we're looking at, who is the best fit to go into that job? Could be an internal candidate, could be an external candidate. And so, again, as you're looking at building bench strength, the more that you're clear about role clarity for the job fit, and then you move into individual performance. To what extent are individuals performing up to the expectations of the job, those 5 key accountabilities, and achieving the goals set for each of those metrics? And then we look at how they work together as a team, recognizing that different behavioral styles are going to interact differently. And our research shows that if you're going to put together an ideal 4-person team, you would have 1 D, 1 I, 1 S, and 1 C. Well, now we have the combination of DI, IS, SC, DC, and so we look at the behavioral styles and motivators of members of your team to look at how they work together or not. And then the last part of this is seeing the bigger picture. To what extent do you and your team spend time looking at the bigger picture of what's going on in home health care and how your agency fits into that and the things that you're doing moving forward? And this was one of the insights that came out of that very first CEO leadership study that Chip Liversidge and I did, when we asked CEOs, what's the one competency that you want most developed in the members of your team? They said, seeing the bigger picture. And so we followed that up with interviews and focus groups and said, well, what does that really mean? And from that, we were able to get a better definition of what it means to be able to see the bigger picture. So developing your C-suite team, and then getting ready for the future is all about developing the next generation of home care leaders. And so it raises the question, do we buy them or grow them? That is, do we have a process to internally develop leaders so that the next generation is coming along behind the current generation? Or do we have a strategy that says, when we have a vacancy, we're going to go outside and find the most highly competent person out there to fit this particular role, and we're going to bring them in from the outside? And again, no right answer or wrong answer, but it becomes a matter of strategy and of corporate culture. I had the good fortune to spend time in my early career on the staff of what was called Dana University, which is the in-house leadership development center for the Dana Corporation in Toledo, Ohio. How many remember Tom Peters and Bob Waterman's early best-selling book, In Search of Excellence? A few of you. Well, Dana was one of the 14 best-run companies according to Peters and Waterman in Search of Excellence. And our chairman, Ren McPherson, was quoted about every other chapter. And part of Ren's philosophy was this notion of promote from within. And so he created Dana University, the Leadership Development Center, to develop leaders at all levels within this $4 billion corporation. Then it's $40 billion now, because they really believed that they could do a better job of getting ready for the future by developing their own leaders than they could by hiring people from outside who didn't understand the culture of the company. And culture and values is an important part of what made Dana so successful. So, questions, comments, observations about anything that we've talked about up to this point? Well, if you would like to download a copy of the full report, it's on the infographic, but it's also here on the screen. Go to dnaofaceo.com. It's a page on our website, but it has a unique address, and you will see this infographic, and then you will see a picture of the front cover of the full report. It's about 20 pages. Just click on the link. It will ask you for your first name, last name, email, and I think your company name. Many of you have already participated in the survey, so you're already in our database, but it'll just verify who downloaded the final report. If you have not yet taken the assessment and you are a CEO of an agency, you can go to a website that we created last year at this time specifically for VNAA. So it's leadinghomecare.com/talent-solutions/VNAA-CEO. And that's not in the slide set that's on the site, so you'll need to write that down. But if you go there, you'll see a couple of buttons. There's a home health CEO button, and there's a private duty CEO button. If you have a private duty business within your agency, and you would like the director of that business to take that CEO, send them to this site, and have them click on the private duty CEO assessment, and they will take the assessment in the report. As soon as you click submit, it takes about 20 minutes of uninterrupted time to go through it. As soon as you hit submit, the system will email you a copy of your own report. We will also get a copy of it, and if you would like to have a conversation about it and does it mean, just send us an email, let us know, and we'll be happy to schedule about a 30-minute phone conversation or sometimes a video conference to walk through the report and what it means. If you have a chief operating officer or administrator or a chief nursing officer and you would like to have them participate, or if you are that person and you would like to participate in a new study, I have used to be a purple bag, but it wore out, so now I have a blue bag. I have my little blue bag. If you would bring your business card up and write CNO study or COO study and put it in the bag, I will reach out to you and we'll send you a link for that person to go in and take the assessment because we saw the differences between the CEOs and their entrepreneurial hook style and the CNOs, we said we need to do more research on this and we need to see what the chief nursing officers look like. August 2015, Avalon, New Jersey. Do we have any Biota folks in the room? Mark Biota was here on Wednesday and Thursday, I guess. August 2015, Uncle Bill's Pancake House, Avalon, New Jersey. I had sent Mark a note and let him know I was coming to New Jersey for a couple of weeks to put my feet in the sand, and if he had some time, and he came right back to me and said, yeah, I'd love to get together for breakfast, my favorite breakfast spot. Mark has a summer home at Avalon, and so we walked into Uncle Bill's and we spent 3 hours, and the first thing he did when we sat down is he handed me this card. It's a plasticized 4-fold card called the Biota Way, and it articulates the vision, mission, values, and philosophy of Biota Home Health, which is probably the largest privately owned, family-owned home health company in the country. They have 300 offices around the U.S. At this meeting, Mark told me they had done $1.2 billion in revenue in 2015. And so, as I said, we spent 3 hours drinking coffee, eating pancakes, and talking about the Biota Way. And Mark started this company in 1975, and his whole focus as a leader has been about the culture of the company. And as you look at one of the panels, it's the vision. And if you blow it up, right here in the middle it says, we want to build and maintain a lasting legacy as the world's most compassionate and trusted team of home health care professionals. Build and maintain a lasting legacy. And I thought that was powerful, and it caused me to think about each of you. And I said, what's the lasting legacy that you will leave in your agency when it's time for you to move on to whatever's next for you? What would you like to be known for, and what would you like the agency to look like? And he says, we will accomplish our mission and achieve our vision by following our core beliefs and values. It's about crafting a culture. We talk about culture as the way we do things around here. And the culture of an ageist is influenced by 4 things. The leadership style of the CEO, the core values that guide your thoughts and actions, the behavior that you expect, and the behavior that you permit. And those are the 4 things that create the culture of your organization. I've got a new book coming out in a couple of weeks called Conquering the Crisis, Proven Strategies for Caregiver Recruiting and Selection. And part of the solution is about creating a culture, what we call a culture of attraction and accomplishment. It's creating an organization where the way we do things is focused on attracting and retaining high-quality people and accomplishing amazing things. And so what's your culture look like, and how does your culture contribute to the outcomes that you're getting, and how does that contribute to the legacy that you will leave? And have you defined what you want that legacy to be? A year later, August 2016, Avalon, New Jersey, Uncle Bill's Pancake House. 8:30 in the morning, Mark walks in. We sat down, we exchanged pleasantries, and I said, well, Mark, tell me what's new in a year since we were here last. He said, well, I just announced that you'll see more on this in the next couple of months. But he said, I've made a personal commitment. My words, he's made a commitment to his legacy. He has made a personal commitment to donate 80% of the shares of Biota Home Health, Inc. to a 501c3 not-for-profit organization. And so the company will live on in perpetuity, owned by a not-for-profit organization. The other 20% goes, I presume, goes to family and key leaders. Does anybody know any other company that's ever done this? How many are familiar with Hershey Foods? Hershey Chocolates, Hershey Kisses. When Milton Hershey formed the Hershey Chocolate Corporation and created the town of Hershey, Pennsylvania, he never had any children, and he had a personal passion for orphans. And so when Milton Hershey was ready to give up his role at Hershey Chocolate Corporation, he set up a foundation. It's called the Milton Hershey Foundation. And all of the stock of the company went into the foundation to support the Milton Hershey School for Boys, which exists today, and one of my high school friends taught there for all of his career. The problem with the will and with the foundation was that Hershey Chocolate made so much money that they could never possibly spend it on education at the Milton Hershey School. So they broke the trust with the court's approval, and they set up the Milton S. Hershey Medical Center in Hershey, Pennsylvania, which is a huge hospital run by Penn State University. And so this is an example of folks who have left a lasting legacy by creating not-for-profit organizations or foundations. Now, many of you are with not-for-profit organizations. And so what is the legacy that you will leave behind, and how can using some of this information help you to take your company to the next level? If you'd like to download the report, there's the website. If you'd like to take the assessment, there's the website. Thank you very much for being here. It's been a real pleasure. I hope you enjoy the rest of the conference and have a safe trip home.